Welcome to Biopara Hub. So I'll be treating Trichuris SP tonight. And before I continue, don't forget to subscribe and like this video. So we are going to look at the classification, the features, the life cycle, the epidemiology, the pathology and the pathogenesis, and the diagnosis and treatment of this particular worm. So Trichuris sp fall under phylum. So let's first of all start with the classification. So they are under phylum Nematoda, class Adenophoria or the Aphasmida, order Trichurata, family Trichuridae, genus Trichuris, species Trichura, volpes, we have the ovis, and we have the sus. So these are the classifications of Trichuris sp. But the particular species we are going to be looking at today is the Trichuris trichura. The Trichuris trichura. The Trichuris trichura. Now let us look at the features of these parasites. Now, these parasites are intestinal nematode parasites of man that affect the lower part of the alimentary canal. What do I mean? They are nematode parasites that attacks man in the intestine, and the part of the intestine is the lower alimentary canal. So they are intestinal nematode parasites of man that affect the lower part of the alimentary canal. Their size is up to 30 to 50 centimeter, 30 to 50 centimeter long, and their females are always larger than their males. Their females are always larger than their males, so their males are smaller than the females. So Trichuris trichura, they lack excretory organs. They lack excretory organs, and they cause a disease known as trichuriasis. Trichuriasis. So these are the features, the basic features of this parasite. Now, let's go over to the life cycle of this parasite. We cannot completely discuss a parasite without knowing the life cycle. So I'll briefly explain the life cycle here now. The life cycle, it begins with the injection of the infective stage, and the infective stage is the L2 larva. The L2 larva begins with the injection of the L2 larva, which is the infective stage. And so when this infective, how does these eggs come to their infective stage? It comes to the infective stage by when the host releases or passes out feces. Now, the feces will embryonate, and I've talked about what embryonation means earlier. Embryonation is the molting of eggs from the L1 to the L2 larva. So when they molt, when the feces are being passed out, the eggs inside the feces will stay for like 21 days, or basically 3 weeks, before it molts to the L2 larva. So when it molts to the L2 larva, that's when it will now it is now in its infective stage. And so when it is being ingested by another host at the L2 larva, so when it reaches the intestine, the larva hatches inside the intestine. And so when it hatches inside the intestine, the eggs will now grow to the adult worms. It will then grow to the adult worms. And when they grow to the adult worms, they are now capable of laying eggs. And so when they lay eggs, the host passes it out as feces. It passes the eggs out in form of feces. So when it passes the feces out to the external environment, it will now undergo another embryonation to the L2 larva, and it will start afresh. This is the life cycle of Trichuris trichura. And take note that each trichura is capable of laying 1,000 to 10,000 eggs per day. 1,000 to 10,000 eggs per day. So the next point we're going to be looking at is the epidemiology. Epidemiology. Now, when we talk about epidemiology, we are looking at factors that influence the distribution of the parasite or worms. The factors that influence the distribution of the parasite or worms. And what are these factors? Physical factors. Physical factors, which include warm climate, humidity, heavy rainfall, and others. So these are factors: warm climate, humidity, and heavy rainfall. They are physical factors that can influence the distribution of these nematode parasites. And another factor that can influence its distribution is poor sanitation and proper hygiene. Now, I'll use an instance to explain this now. Assuming a child carrying Trichuris eggs passes out feces in a bush, and then the eggs of Trichuris inside the feces is used as manure on a farm. So when these eggs will now enter the vegetables probably or other food there, so if it is not being washed and cooked properly, it will transmit to another host, and this is how its life cycle is being this is how the life cycle undergoes. So these are the factors that influence the distribution of Trichuris parasite. Now we go over to the pathogenesis and pathology of these parasites. Now, when we talk about pathology, we are talking about the diseases it causes. So, a human carrying 100 worms and below probably will not show symptoms or clinical symptoms of will not show its symptoms. But when it's carrying excess worms, it will have serious complications which can actually lead to death if not properly treated. So these worms can cause what we call anemia and secondary bacterial infection. So you know that these worms, they suck blood. So when they suck your red blood cells, it will now lead to the shortage of the blood, which is anemia. So this is the number one disease it causes: anemia and secondary bacterial infection. And this secondary bacterial infection can result to what we call colitis, rectal prolapse, and proctitis. So these are what secondary bacterial infection can cause or can result to. So it can also cause the inflammation of the appendix, which can result to the appendicitis. But basically, it is not only this worm that causes appendicitis. The other factors that causes appendicitis, but it is one of the factors that can cause appendicitis because it inflames the appendix. And these worms can also cause some symptoms such as abdominal pain, constipation, nausea, loss of appetite, and urticaria, and so on. So how can we diagnose Diagnosis. So we'll go over to the diagnosis and treatment of these worms. Now, the diagnosis, it can be diagnosed by demonstrating the presence of Trichuris eggs in a fecal sample. Can be diagnosed by the what? By the demonstration of the presence of the Trichuris egg in a fecal sample. And how can we identify a Trichuris eggs? A Trichuris eggs are not encapsulated. They are not encapsulated. And they possess polar plugs. The size of their eggs ranges from 49 to 65 millimicrons by 20 to 30 millimicrons. So, how can we treat this trichura? The drug that is used in treating it is called the mebendazole. So, if you look at from all my previous teaching, mebendazole is the common drug used for treating these parasites, nematode parasites especially. But for example, like for amoebiasis is the drug used for treating amoebiasis is triclabendazole, paromomycin, and lidocaine and some others. So, and another drug for treating this trichura is enema of hydroxyl resorcinol. In a distilled water can also expel the worms. So this is another drug. So mebendazole and enema of hydroxyl resorcinol, these are drugs for preventing or curing Trichuris worms. So how can we prevent these worms? They can be prevented by washing of our vegetables and fruits, washing of our hands after going to toilet, and treating human feces before using it as manure. So this will actually be the end of this for today. So thank you for watching, and stay tuned for other videos in biology and parasitology. Thanks for watching. Bye for now.